Sawadika, Ajahn. Today I would like to present evidence-based nursing in patients. My intervention program is pelvic floor muscle training on elderly women at elderly club. Intervention. Women because of age, race, acid, childbirth, hysterectomy, oral home therapy, obesity, cognitive impairment, mobility impairment, and diabetes. Control of the urinary tract system in women is directly affected by loss of pelvic organ support and loss of estrogen at menopause. Up to 70% of women with urinary incontinence related to the onset of the symptoms with menopause. Guidelines recommend PFMT as the first-line treatment for women with SUI, UI, or MUI. Exercising the PFMS can strengthen them so that they provide the support body need. They will improve bladder control and improve, or even stop, leakage of urine. Like all other muscles in body, the more people use the exercise then, the stronger they become and stay. In addition, it's convenient for people to exercise it at any situation and any time, such when at home, outside, gardening, talking, shopping, studying, and down. Then I will apply this intervention to help the elderly people in elderly club. The objective is to examine effectiveness of PFMT in elderly women with urine incontinence. Study methodology. Searching frame. The PICO strategy to get data collection as specific guide to extract information and classify the quality of the results. P is the population. Includes old women with stress urine and mixed urine and urgency urine is defined as aging 60 years and older. Intervention is the PFMT program. Compare is mentioning the message and content of PFMT program intervention. Outcome is mentioning the methods and content of the most effective basic muscles training for old women diagnosed with UI. Inclusion of the criteria. The full text study year between 2010 to 2020. The article language is English. The experimental study which meets PICO frame will be included. The population needs more than 60 years. I use the keywords in 3 database and finally select the 3 articles. I use the GBI critical appraisal checklist to assess the 3 articles. About the data extract and synthesis table, the link is as follows because the time limitation I do not to show the detail of this table. Results. All 3 articles are RCT. About the initial evaluation, 3 articles use this to evaluate the people. The first one is the Brother Diary. The second one is International Consultation on Incontinence Questionnaire short name. Inclusion of the criteria among these articles is the seminar. I summarize it as follows. First one is 60 years and over. Second one is have stress or mixed urinary symptom at least 3 times a week, persisting for 3 months or more, able to have a gynecological examination. If the patient have with the pain, Hematural had a history of recurrent urinary tract infection, physical surgery, or radiotherapy. Continuous leaking suggests ventral or suspected of nervous system disease. They will be recommended to visit expert. The detail of the PFMT program. For there are the first study compared the group regular face-to-face practice with individual individual program. It's reported that the group's regular face-to-face practice is effective. Another one recommends that internet family PFMT practice is better than post-way. And the last one recommended that the PFMT program is better than ET program. For the attribute PFMT program, the intervention time from 12 weeks to 20 weeks includes 1 or 2 experimental experienced physiotherapists to treat the PFMT once a week. Participants are required to attend more than 90% of the course. Weekly session at least last 1 hour and include 50 minutes educational period and 45 minutes exercise component. For the remaining 5 or 6 days, the patients need to practice this program and have a record at their home. One by one counseling sessions are also offered to ensure that participants understand the knowledge of exercise and better components. The components in most of the important about this training. For comment of the PFMT program, there 3 articles have some similar and maybe a little few difference between them. I summarize the family comment as follows. First one, the education. The education includes once a week per 50 minutes. Second one is the function of the PFMS includes use of pre-contraction, weight management strategy, normal blood control, and avoiding parental fluids and fluid intake, optimal toilet position, all things dynamics and benefits of general exercise. The third one is lifestyle change. The exercise level suggests that once a week for 45 minutes face-to-face exercise, the person have the special experience will guide them to do and combine motor control strength, endurance, power, and functional training in a variety of different body positions. There will be a video to perform the knowledge. For my evidence-based nursing intervention will follow this program. The outcome evaluation 2 of 3 articles is as follows. The guidance recommends that the PFM exercise for the women for at least 3 months before you start to work, and 6 months before you start to effective work. The study has demonstrated that older women are able to improve their incontinence symptoms with the exercise program and incorporate motor learning strategies, strength, endurance, power, and functional training if they keep training. Therefore, it's crucial that patients keep exercise for my intervention program are continued home PFMT record list be developed to prove the intervention outcome. Summary and recommend a method to combine regular professional made face-to-face interaction with family exercise. It has overall improvement effects on the elderly women with SUI, OUI, and MUI. Since it's not an invasive operation, it has no side effects. Compared with biological therapy and surgical treatment, it also has the advantage of no cost. The program is recommended for 60-year-old women and over the age of 60 in community and elderly care. That's all. Thank you so much.